Welcome to the Functional Nurse Podcast, where we explore how nurses are transforming healthcare through functional medicine and nurse-led innovation. I'm your host, Brigitte Sager, founder of the Institute for Functional Nursing. Here, we're reclaiming our role as healers and leaders, one root cause conversation at a time. Hello and welcome to this episode of the Functional Nurse Podcast. My name is Brigitte Sager and I am a functional nurse practitioner, a nurse educator, and I am here today with Dr. Holly Lucille. I am so excited to talk to her today. Thank you, Holly, for being here today.
Yeah, my pleasure.
I am going to take a minute to tell everybody your vast amount of experience and why you're here with us today, and then we will get to talking. Dr. Lucille is a nationally recognized and licensed naturopathic doctor, educator, natural products consultant, author, and television and radio host. Her appearances include national media programs and networks such as ABC, NBC, CBS, Fox, Dr. Oz, The Doctors, Lifetime, and the Discovery Health Channel. Holly is a senior medical advisor at Fullscript and the chair of the Institute for Natural Medicine. At Fullscript, she provides strategic direction for the organization and helps create, review, and curate Fullscript's medical content. As a graduate of the Southwest College of Naturopathic Medicine in Tempe, Arizona, she received the prestigious Daphne Bladen Award for her commitment to naturopathic medicine, academic excellence, compassion, perseverance, loving sense of humor, and positive, supportive outlook. She practices in Los Angeles, California, where she focuses on comprehensive naturopathic medicine and individualizing care, following the rigor of science, the power of nature, and the essence of care. And for the reason that we have her specifically on the show today, she's also a registered nurse. And we're really excited to have her on this episode. She is here specifically because I asked Fullscript for some support in answering some of the questions that I get from many of my students about how nurses and nurse practitioners can use supplements to support patients from a functional medicine perspective, an integrative or holistic nursing perspective, whatever you want to call it. We're all have the same goal. So thank you again for being with us today. And I would love, Holly, if you took the time before we get started in some heavy questions on this topic for you to share with us your journey to becoming a nurse and a naturopathic doctor.
Yeah, thank you so much. And thank you for all that. Just made me feel tired and very old. No. So it was fascinating. My parents, I grew up in the Midwest, the daughter of two pharmacists. And even from a young age, for some reason, I was always just kind of like bumping up against their here, take this approach. When I was even little. And the way I got into nursing was that I didn't know what I wanted to do. My dad was like pushing me to go into Western allopathic medicine, and I knew I didn't want to. And so I was in a volunteer class at a hospital to volunteer during a summer between, I think it was my junior and senior year. And I learned that this is what I thought I learned. It might have been different. It was a long time ago. But when people were admitted in the hospital, they lost some of their rights, like maybe their right to choose or their right to privacy. And I just was a bit incensed, and I felt like I have to get in and help. And so that's what led me initially to join a bachelor's degree program in Allendale, Michigan at Grand Valley State University to become a nurse. And I thought it was an amazing education. But there was still something for me personally that was missing. Kind of like almost like the same way I felt about my parents. And I was like, well, I'm the common denominator. I must just be the problem. And then it was one of those fateful days in your life where something was sent to me. I must have been on some list, and I was flipping through this catalog for the Omega Institute in New York. And it said holistic nursing. I'm like, well, what is holistic nursing? And so I called the number, and at that time, the president of the Holistic Nursing Association answered. And 2 weeks later, I was on a plane to start my post-grad certificate program in holistic nursing. That's where I actually started to really kind of click in. It's like, I say that it's where my soul kind of came home, because, with this incredible education as a nurse, and then more of the holistic principles, I just kind of locked into, there's more universal theories about how to care for people. So it wasn't my education, it was how I could approach people with it that really made the difference. And then it was through the American Journal of Holistic Nursing that I found out about naturopathic medicine. And I was like, well, what is this? And then that was just my next step. So there you go. But I say, once a nurse, always a nurse.
Yes. And you used that word that so many of my students use, is the word home, that finding the holistic nursing piece when you're a nurse, and you have that. I think many of us speak to that you just mentioned, that something doesn't feel complete about what we've learned so far as a nurse until we find holistic nursing. And all of a sudden it's like, this is what I was looking for.
Yeah.
And so many of my students say functional medicine is what I was looking for. And I didn't know it until I found it. And I think that's interesting that you use the word home too.
Yeah. And you're right. That interchangeable, holistic, functional, integrative, whatever it is. And I always say this, it's not that education. It's how you use the education to work with people and to care for people. It's the style, right? It's the approach that's different. And that's what really makes, I think, that home piece and things really lock in and make a lot of sense.
Yes. And before we hit record, we were both talking about like what was available to us before we learned what we're doing at this moment. And, for me, my students will ask me, oh, would you have become a nurse practitioner if you had learned this sooner? And I said, this is my journey. And we were talking about, you have had your journey, and, every nurse is on their own path that leads them in a different direction. So I'm glad we get to hear your story and your perspective today, because I know my students always tell me they love hearing the stories from the other nurses that I interview on the podcast, because they find it relatable. And there's something about feeling alone when you journey away from the allopathic model as a nurse. And so I love that we get to talk about that in this setting. Okay, so I wanted to start with a question about how you view, I feel like nurses have the potential to play a huge role in integrative, functional, we can use any, like you said, we can use any of those terms. What role do you see registered nurses and nurse practitioners playing regarding the use of supplements? Because that is what we're going to talk about today, right?
Yeah. I mean, okay, so I'll just get this out of the way. This is my view. I think this is my view, because I know that the scope and from a legal perspective is different. Obviously there's a difference between nurse practitioners, which have a different scope and can have some prescribing recommending privileges, and nurses maybe not so much. But where I think it really makes a big difference, so I'll back up. I think nurses should have a healthy scope to learn, educate about, and also recommend dietary supplements. But I know that recommend piece is difficult. And I know there's some brilliant people out there, trying to sort of expand that scope so it's not so much. Mm-hmm. But the point that I want to make is, I think nurses have so many touch points with people, right? And education then is where it's at, especially in this day and age where there are so many consumers, patients, people. There's so many other people that are profiting, I should say, off of these low quality, worthless, if not dangerous products that are not about quality at all, more just like the latest trend, especially when we have these social media, like TikTok videos out there, and people are getting kind of swept up into them, and they're really not knowing what's going on. And I think nurses would have play an incredible difference with just being able to simply educate. That would be one of the most important things when it comes to dietary supplements these days that nurses can do.
Yes. And the sourcing part, because you and I both know there is not one brand that is perfect, the perfect version of every supplement. And that's one thing I love about Fullscript is its access to many that we can speak to, right? And offer to our patients and clients. And so for a registered nurse to be able to say, this is what I trust to use, and give that access to their patients, rather than say, go to the store and hopefully find the, hopefully find a good product.
Or go to one of the rando sites, or even the big A1, it's like, no, when you have a company like Fullscript that does that heavy lifting, that understands quality and has a quality mission, then it's super easy to set up access to high quality nutritional dietary supplements and point people in the right direction. And that's definitely one of the things that Fullscript, outside of, being a tech company, but an educational company and so much more. That's certainly one of the things that has helped automate my practice and so many others.
Yeah, and then in the years I've been using it, I've just seen the support and the amount of things offered has just grown and grown. And it is like, it's education. It's so many things I know you're going to touch on today, which is wonderful. Yeah. But, I am not about making any profit off of supplements. I always tell people I use Fullscript because I want to know where my patients are getting their product from. And I want them to know that I've done the work for them to know that it's going to be quality for them. And that's something, because when I worked in primary care, I would write prescriptions for supplements in hopes that it would be covered by insurance. And I would find that they were low quality, or I didn't know what they were going to get and whether it was even going to get covered. But that the quality was the thing, right? Like, if you don't use quality, it is a waste of somebody's money, and they could have spent that on maybe some self-care or some whole foods, right?
Yeah. I mean, and a lot of times out there, there's all this seductive messaging and marketing from the industry, and people don't know any better unless they are talking to somebody who they can trust. And that's where I think nurses come in big time. And I also think that partnership with Fullscript, because same with you, I set my margin, and this is another great feature with Fullscript, to zero, meaning I don't make a profit off of things that I recommend either. But for me, it's a marketing tool with my patients. It's like, hey, I'm going to, give you 35% off, but here's a place where you can go where you can trust. And it's a relationship builder. It's almost like relationship marketing with the people that I care for as patients, because it makes things so much easier for them from a user perspective. And it is that piece of communication between myself and them when it comes to that quality piece. And it's that trust. And so it goes a long, long way.
We are on the same page there. I agree with you 100%. Thank you for saying that. We talked a little bit before we hit record, and in the course and with nurses I talk to all the time, we talk often about the scope of practice of registered nurses and nurse practitioners when they're practicing functional medicine. Since RNs cannot prescribe supplements, how can they best support their patients interested in taking supplements?
Yeah, it was interesting. I was down at the Nurse Practitioner National Conference in New Orleans earlier this year. And in talking to people there, even though nurse practitioners might not be in the lane of prescribing or recommending dietary supplements, 100% of the practitioners that I did talk to noted, and this is obvious, that their patients that they were caring for were on dietary supplements. And so I think that's important. I mean, even if you for me, I would say I rarely will prescribe within my scope a pharmaceutical agent. But because I know that my patients are on them, I have to know about them. I have to know interactions. I have to know contraindications. I have to know mechanism of action, right? And so same thing. I think it's so important for nurses to be able to know more and more about them so they can educate. And then consumers can rely on that for good, solid information about quality and efficacy and just the overall need.
I agree with you. And I think that the opportunity for nurses to offer that piece through Fullscript, and them being able to go there and send people, and not, time is such a big part of what we do in functional medicine and in healthcare overall, right? We're trying to decide how much time to spend on education, how much time to spend charting, how much time to juggle all of these things. And so that's one of the things that I really like what you're speaking to about, they're already on them. And what if they're on 10 and you sit down at a visit with them and that isn't part of the plan for that visit? You can still say, here's the link to a place where I respect and you can source from. And we could talk about these more at our next visit, but you have a way to say, here's something to rely on that isn't going to take time away from the visit. I think that's great.
No, and I love your approach to being able to kind of do this work around RNs that can't, quote unquote, recommend or prescribe, because education is the key. I mean, dossier, right? It means to teach. That's basically what we're here to do. I mean, it's almost like that whole adage of like, yeah, you can, make somebody some fish, or you can teach somebody to fish. And then they have that power, they have that control. And that education piece is so important. And like you said, if somebody is on 10 and you've got a nurse that gets to take the time to say, hey, can I take a look at them? And they understand that maybe there's a lot of standalones, but they also know at Fullscript, they could maybe get a combination product that is going to be at appropriate doses, right? Not just a label claim, but those doses will have a body claim that can decrease maybe some of the purchasing amount that that person is going through, and also increase compliance because they get to take less pills. Then that's another angle that the nurse would be extremely valuable for in just pointing a person in the right direction.
That is such a good point, because pill fatigue is a real thing. You and I both know that. People come back and they're like, how much longer? We talk often.
I look at my phone sometimes and I'm just like, not today.
Yep.
Not today.
Even just like, I find like just vitamin D3 with K2 and I'm like, whoa, okay. Like anything that makes it one less is so wonderful. And so the next question I have for you is, being aligned with Fullscript, what are some of the emerging trends in supplements among nurse practitioners and RNs that you're noticing?
Okay, so as you said, I'm part of the integrative medical advisory team at Fullscript. And gosh, I notice nurse practitioners are very, very engaged, just so are nurses, in that educational piece. But from a trend perspective, what I see is people are obviously paying attention to the overall sort of microbiome, right? So you see things, and so gut health. I mean, as a naturopathic doctor, we had a saying in school called heal the hole. And it is the hole that starts here and kind of ends back there. And so overall gut health just has so much to do with overall health and period. The ability to take in nutrients and digest, assimilate, absorb them, let those nutrients drive your biochemistry, do your body's good and do the body's work. And then later on down the chute on a regular basis, get rid of those waste products that are made from all of those things that go on. And so, I see things like GI Revive or probiotics or glutamine. Those are really trendy, and I think people are really engaged with that. And then berberine, I've seen be really important. We're always talking, I think, more and more about metabolic health these days. Also DHEA, magnesium being the number one mineral deficiency across the United States. And then, of course, the number one vitamin deficiency. Well, we could do a podcast on it. Is vitamin D
All right. Yep.
Vitamin? We can do another podcast on that, but being vitamin D, that as well. And then things to support hormones and the hormonal processes that we have in our body, the way our body looks at estrogen as a toxin and detoxifies it. So diindol methane, other things like inositol, things where there might be like a PCOS diagnosis or something like that. So those are some of the trends that I see. And then just the coverage, ever since the pandemic, knowing that zinc and vitamin C and maybe a B complex, just making sure that we can assure any nutritional gaps in somebody's lifestyle. I see that as well.
I'm like listening. I'm like, okay, my students understand all of that completely. Sometimes I'm like, oh, we're going to go too far. But that is that you're speaking their language. So I think that is very relatable examples. And, we talk all the time in the course about the gut health research is just, you're talking about the gut microbiome. And, I've recently been talking about the vaginal microbiome, and we have all these microbiomes, and supporting that being not, you said trend, and it is a trend, but it also is like, it's the future, right?
Oh.
It's what we're going to see more and more of.
Yeah. And, it's the past. We just weren't, I graduated school in 2001. And I tell you, I don't even think my professors uttered the word probiotic. I really don't. It was so but through the Microbiome Project, the research is so robust, and each and every day, I mean, it's like almost who can keep up. That's another thing that Fullscript is so great for, is because who can keep up? They can, because they've got a big machine behind everything. And it just helps with keeping up with the research and the strains, different precision probiotics that are out there that can, get so precise in an action, like with OCD even, right? Some of our, and that comes back to what we've always known as the gut-brain connection, but it's really being displayed now in the literature. And I just think it's fascinating.
I agree. And we talk about that, like that you can have a study now that will show a strain that benefits a diagnosis. And like, imagine that, like when I started my nursing career, like that, who would talk like that? And I say often, I'm like, I hope someday my course is obsolete because this is acknowledged in school more. And I always say, you know, my course is teaching nurses that what they learned in nursing school has more value and meaning than we are taught once we enter the allopathic model. And so I feel like all these studies that are coming out and what we're talking about right now is like validation that us talking about food and what feeds the gut microbiome and like how we can support immune health, nutrient deficiencies. You know, I tell them, I'm like, if you want evidence, we might have to go grab a biochemistry book because this isn't something crazy I'm talking about here. We're talking about cellular demand in the body.
Yes. Yay.
So, okay. So the next question I have for you is, in the course, we talked often about the role of nutrition and supplementation in supporting patients. Can you share some approaches or strategies that you use to close nutrient gaps?
Yeah, I mean, let's just riff off what you just said. It's like, okay, so nutrients and that, for that matter, nutrition. I mean, it's so important for overall health, period. If you've ever taken a nutrition class, it's like taking a biochemistry class and vice versa, right? If you ever taken biochemistry class, it's like taking a nutrition class because these ingredients, these dietary supplements, the things that are in them, they're so much more than a few aisles in our local health food store or online at Fullscript. They drive our biochemistry. They're cofactors, right, to those chemical reactions. You know, to get to here, you know, you see it written on the chalkboard, right? It might age me, but over there you need this, that, and the other thing. And they're so crucial. And when there are deficiencies, it can show up as a clinical condition or at least contributing to a clinical condition. So of course, you know, diet, or as I like to say, habitual nourishment. I like to look up words, and I'm just going to, one of the most fascinating words I've ever looked up is diet. Like, what does diet actually mean? And I was so fascinated when, if you really think about what diet means, it means habitual nourishment. How, as a habit, do people nourish themselves? And it changed the way that I talk to people about their nourishment, because some people don't even feel worthy being, you know, to be nourished. And so that whole diet piece just got a little bit more fun for me. But as we all know, diet is foundational. So we're always talking and learning and tweaking that. But as well, nutritional supplements are so important. And not only to recover perhaps a proposed deficiency, but as we well know, we can actually treat and prevent things with optimal doses that are consistent with the literature. So that those nutrient gaps in our modern day are vast. And I think that habitual nourishment and then supplementing that nourishment when needed, from a proactive perspective or a treatment perspective or a repletion perspective is so important.
Right. And like, how many people is our first couple visits where we just tune up their diet and they see a drastic improvement in their health, right? Like, food is everything, in my opinion. And I'm writing a nutrition course right now, and I get hung up on that word diet, and you know exactly what you're talking about. And it has so many connotations that we don't even, like, people don't realize they have associations with it that aren't that real term of what, you know, the definition of it. So with the students, I always talk about, you know, especially in the scope of a nurse, you know, food first approach is always ideal. And when any time that we can improve somebody's diet and improve how they're eating or their nourishment, their food choices, and what they're going to do long term, we are improving not just their health, but the people that they feed on a daily, you know, their other people in their lives. Even, you know, that you have your healthiest person at work and everybody goes in the break room and sees what they eat for lunch, right? And they never get sick. So I think it carries over beyond just impacting that patient when we focus on food. But I think you were touching on the fact that there's deficiencies that just aren't being kept up with. You could eat as much as you want, and you know, we're able to measure now that, like, can you really get enough magnesium from your diet? Like, there's things that supplementing long term is the right approach, but that isn't in any way my goal. Like, I try to teach them, always focus on food. Even when we're talking about the gut microbiome, like we want to use prebiotic, probiotic foods and focus on that. But there are absolutely things that we know now are not going to be gained from even an organic, whole foods, plant-based diet, like focusing on all the right things. We still know there's missing pieces. And so that's where I think the things that Fullscript offers is our opportunity to support people in that way.
Yeah, you're right. I wish diet could be enough. I mean, and I think maybe it used to be, right? But, and it's like my friend says, it's not the food, it's what we've done to it, right? We've got this compromised food chain any further. We've got compromised soil that's zinc deficient, selenium deficient. And then we've got a lot of people's compromised choices, right? And a huge industry that pushes nutritionally valueless, addictive, and harmful foods. So we put all that together along with, I work a lot with integrative oncology and people that are showing patterns of cancering. And from the research, a lot of times we will advocate a more ketogenic milieu, right? So low carbohydrate environment. What are we going to miss there? We're going to miss that magnesium, right? People that are on other restrictive diets, whether they're vegetarian or vegan, we want to take all of that into consideration, understanding what's missing in those. And again, then there's an appropriate place to educate on supplementation. Supplement just basically means adding to or sort of beefing up, pun intended, something that's already there. So if you've got a diet that is restricted, there are some things that are going to be missing. That is when we go to a supplement. Medication-related nutrient depletions. That's a big thing. That's a huge thing. Again, as a naturopathic doctor, don't prescribe them a lot, but need to know about them because if my patients are on them, I need to know what is potentially being lost because they're taking them from a nutrient perspective so I can help replete that.
That is such a light bulb moment, I feel like, for nurses. And I'm sure when you learn this in school, like that, we learn about all these medications and their benefits in nursing school, right? We take pharmacology and we talk about that, and we do not acknowledge the nutrient depleting aspect of medications whatsoever. And so many students in my course will mention, after I'll say, what is something that you really stood out to you from the first module? And just right there, they're like, I didn't even know that. And then having a resource for that and being able to educate patients on it. And often the light bulb going off that that's the problem for the person, right? They have a symptom that they've come to you for, and it's actually a result of something that's going on because of the medications they're taking.
That is why we learn, I think, the most about pharmacology is to understand that whole picture, not only the mechanism of action, but also those nutrient drug interactions and deficiencies are super important because, yes, they can show up as what? Another clinical condition. And guess what? If they stick to their allopathic lane, what are they going to get because of that second, subclinical condition? They're going to get another medication. We've seen it all too many times.
I had this moment when I was first learning functional medicine where I woke up from sleep, and apparently I'd put this together in my sleep. And it was that story of a woman entering menopause and experiencing hypertension for the first time and being put on antihypertensives without digging for the cause. And then, to go from there to, we step up on the doses until they're on 3, and then maybe they see cardiology because it's not effective. So they get put on a statin when they get run through the CV risk calculator. And then that increases their risk for diabetes, and next thing you know, they're on metformin and they have neuropathy and they're put on
yes. Oh my gosh, I'm so sorry that woke you up out of a sleep. I write baselines in my sleep, which is crazy, but that is fascinating. But it's true. And if you even look at all of those different categories of medications that you just said, we can actually pull out a nutritional deficiency. And now we've got, as you said, they're going down this rabbit hole, and they've also increased their nutritional deficiencies from being able to try, from that perspective, the allopathic perspective, trying to care for them in that way that just is not working. And it's making things worse.
And now a quick word about our sponsor, the Institute for Functional Nursing. IFN is the leading education and community platform for nurses bringing functional medicine into their practice. IFN offers everything from short, on-demand contact hour courses to the full functional nursing program, designed specifically for nurses and nurse practitioners ready to practice root cause, whole person care. If you're looking for connection and real-time learning, The Functional Nursing membership includes 4 live meetings every month where we cover case studies and have open discussions and connection. Come be a part of a movement that's redefining what it means to be a nurse. Visit fxnursing.com to learn more and join us. And now back to today's episode.
Yes. So I wanted to ask you a little bit more in the depth of the supplements and diet. How do you determine when it's appropriate to use the supplementation, dietary modification, or a combination of the two as part of your strategy when you're approaching drug and nutrient deficiencies?
Well, that intake, and that, again, for you and I, that's where that precious time takes place, right? That's where our business model, I'm assuming, is in order to get this information from people, we have to be more than the 5 to 10 minute, charting really quickly. Okay, fine, vital signs out, because this is where the information is. This is where the data is. It's from that person. What are you on? Why? How long? And then having the database of understanding. Again, I'll say who can keep up, right? If you're seeing a population that happens to be medicated or over medicated, are you going to go look up all of those different medications and see what their nutritional deficiencies are? It's where Fullscript comes in again. It's like they do the heavy work. They've got these incredible, beautiful, well referenced handouts that you can just go. Oral contraceptives. If I know that, what do we know what we are going to be missing? Probably folic acid and magnesium. Let's say somebody's on Lasix. What is going to be, medications have the ability to impact the absorption of nutrients, right, in the digestive tract, also accelerate the metabolism of certain nutrients, also then impact the excretion of those nutrients. And so knowing this is important, but also just having access. I think it was Einstein that said, please don't memorize anything you can look up. Which, yes, which I wanted to sit in front of my instructors most of my career. It's like, hey, I don't really need to circle the right answer on this. I'll have access to it. But with Fullscript, you do have access to all of these different things, so the Leupopenly diuretics, calcium is going to be an issue, perhaps potassium, again, magnesium. People on proton pump inhibitors. My mom had her white knuckle grip on her proton pump inhibitor, and I could go down her entire life and go, oh, yep, check. Oh, yeah, osteoporosis, yep, check. Oh, you're going to lose your gallbladder, yep, check. The whole thing. Statins. We've been petitioning the FDA forever. If you're on a statin, let's consider side by side CoQ10, because it's an HMG-CoA reductase inhibitor. And yes, it's going to stop your liver's ability to do what? It's going to help with cholesterol, but it's also going to knock down something that's so important for your heart, which is CoQ10. And so making sure that you have the time to understand how people are nourishing themselves, if there's any gaps there, and then as well, the medications that they're on, so you understand even further gaps. And then, as the word is defined, you can supplement accordingly.
And what cells in the body have more demand for CoQ10 than the heart?
It's like bleeding 74 plus, it's like, yeah, and it's ubiquinone. It's ubiquitous. It's everywhere in every single cell in our body. And it's a precursor to energy.
So it's, I was thinking, don't get me started on the PPIs. I'm finishing my doctorate work right now. And that is such a passion topic for me, is trying to get people off of these things. And you're right. You can see it unfold, the story.
And for a couple of years, I took a break from a private practice and I worked for a high-end concierge practice. These people that we cared for had more money than time, but I really didn't have a panel of my own. I cared for in an naturopathic way, quote unquote, all these other doctors that had these panels of people. They call them panels. It was just their roster of people. But everybody, I am not kidding you, almost 100% of everybody that I came in contact with from a patient perspective was on the big three. They were on a statin. They were on a proton pump inhibitor. I left there because it wasn't my jam. But
yep.
Not even a need to be, almost like, oh, you're this age, it's time for this. And I just was amazed.
You were talking a minute ago about the time that we as practitioners have with our patients. And it reminded me that that is one area that I try to encourage nurses to consider if they're trying to figure out where to go with this. Is I feel like every clinic, I'm really big into nurse coaching. That's a big part of what Inca does. And that's how I came to all this, is to have nurse coaches and to have functional nurses in every clinic in this country, like what a difference that would make for a provider to be able to say, you're going to go do an intake with my registered nurse and she's going to provide some education for you, or they're going to go through your medication list and look at potential nutrient deficiencies and queue up some lab work that we can look into that a little bit deeper. And so I think the potential for registered nurses to be used in functional medicine is vast. And I had in our meeting last night, we had a nurse talk about her niche, and every cohort we have nurses tell me how they're using this in different ways. That is so exciting. And so I love being able to spread the word about all this and just light the fire under nurses to say, you can go and share this in so many, every healthcare setting can use more of this.
Yeah. And, thank you for all the work you're doing, because I think it's so important just to insert as we can people with that mindset almost everywhere. And on that, I want to mention there are two databases just to get this information, like I said, have access to it. So Mytavin, MYTAVIN. This was developed by Fullscript's Chief Medical Officer, Dr. Jeff Glad. He's an MD, an incredible functional doctor, an incredible person. But in 2009, and he was basically learning about the prevalence of nutrient deficiencies caused by these everyday medications and the lack of understanding surrounding it in the medical community. So there's that. And then also, I'll just plug it again, Fullscript Academy. I mean, there are practitioner resources on drug nutrient deficiencies. They're beautiful. They're well researched. So if people are on these medications, our due diligence is to educate them what they might be depleting and then how we can help replete, if that's a word.
Thank you. Yeah, Dr. Glad is such a wonderful resource and respected speaker and for all of us in this arena. And in the course, we actually use Mytavin as a tool, so the students are familiar with that. For the part of the audience that's in the course, they already know.
Great.
And big question for my students. What factors do you consider in choosing a specific brand or a type of supplement for a patient?
That is a great question. And it can be a hard one, right? Because there are a lot of, this is a huge industry. But I think, even when we were talking about food, I think the thing about food these days for me is quality. It's not the food, it's not wheat, it's not dairy, it's what we've done to it. And so food quality is something that I've just been really caring about and educating and driving home so much. And that's the same with supplements. So that quality story, ensuring that supplement choices are pure, right? So they're not contaminated. There haven't been corners cut in the manufacturing process, because it's a pretty amazing when you basically go from plant to pill, right? What goes into that? A lot. And there are ways to make it cheap and easy, and that shows at the bottom line price point, but there are ways to make the quality stronger. It has to be potent. So it can't just have a fairy dust sprinkling of what that ingredient is that I want. It has to have a body claim, not just a label claim. And then also I would say being considerate of the patient's, the price point and their affordability and the patient's access to it. And so all sorts of things go into me making that decision. And I think, again, it was a lot harder when I didn't have Fullscript. And when Fullscript came into my practice, as you said, each iteration and, each update Fullscript has, there's a new feature that sort of blows everything away. This quality piece is huge. There's also ways that you can, have people sign up for auto ship, which is a great option for patients. They can also filter things by price in the platform in and of itself. And so, but that quality piece for a specific ingredient or from a supplement in and of itself is the most important.
Yeah, I think quality is so important. And you're talking about saving our patients money, right? Like if the cost is an issue for them and access is an issue for them, I feel like Fullscript addresses a lot of that, because like you said, we can choose to profit from the sale of these, or we can choose to not do that and offer them at a really affordable rate and say, I am not making any money off of this. This is just access for you. That's totally up to the provider in Fullscript, which I love. And that it is just a link that you can send. It's not a burden on your time. For me personally, I use Practice Better. And so when Fullscript and Practice Better joined up, I was like, this is going to change my life.
Right. So the integrations with the EHR, and, to your point about profit or not profit, there's also the in between. And there's also always that communication. Hey, I'm giving you 10% off because, I do need to pay my staff. The fact that I have the education that you need in order for me to provide the right recommendation, like whatever it is for that practitioner, there's a whole host of different ways that you can go about it. It doesn't have to be all or nothing. And the other thing too, it's customizable per patient. It doesn't have to be across the board. If you know that somebody's having a really hard time and you want to set that to 0, that can be done. And if you work with a group of, when I was at that high-end concierge, nobody had a discount there. They didn't need it. And so it's all customizable to your need. And it's all about, I think, that patient-practitioner relationship too.
Yeah, right. When you add somebody in Fullscript, it asks you how much of a discount you want to give that person. And so you're right. If you know that they have a hardship, you can extend that to them. And I have talked often about the fact that knowing what we need to know to make the recommendations that we do. Because like I said, there's not one brand that I just say, go buy everything from this company, right? We have all these different brands that might have the very best version of this or that, and that may change over time. So there's this duty that we have to stay on top of that and be informed, which is a task in itself. And so when there is a markup, I feel it's very justified that you're going to have a patient write you back and say, hey, is there a liquid version of this? Or is there one that's not, this flavor? Or I have trouble swallowing this type of capsule. And so the time that goes into sorting those things out and changing recommendations and finding those things, building your recommendations is a justification to choose somewhere between 0 and 35%, right? How much time are you putting into setting up your practice and making personalized recommendations, because there's absolutely value in that.
Yeah, 100%.
Okay, so wanted to ask you, what are some obstacles that you've experienced in terms of patient adherence, and how are you approaching those?
Oh, I love this question. Okay, so I have always believed that there's a difference between compliance, right? She told me to do this, and adherence. Adherence is more like a faithful attachment to something, right? Like, how can I make it sticky for that person? So, and back to a lot of the points that you and I have been talking about, and even my parents, here, take this is very easy medicine. And I even see this in the oncology population. The cut, burn, poison recommendations of chemotherapy, surgery, and radiation are, I'm not saying they're easy on the body. I'm not saying they're easy from a financial perspective, but it's like, okay, there. But what we ask people to do, we ask people to take a look at their lifestyle, and maybe there's some lifestyle modifications. Obviously, take a look at their nourishment. Maybe there are some dietary interventions. And then, yes, perhaps based on the need, there's going to be multiple supplements, in divided doses, perhaps sometimes, and for the right dose. And it's not easy medicine. And so that is something that I've always taken into consideration and have a very, very frank conversation with people about, and I tell them, this is not easy medicine. Here, take this as easy medicine, right? You pay your copay, you get it filled. You don't even have to go to the store anymore. It can be sent to you. You open it, you take it. That's your healthcare. This is more effective. I think the outcomes are better, but not as easy. And so that adherence piece, I think, as we've talked about the price, we do have the freedom to offer custom discounts. That's important. The auto ship, there has been shown that people are 2 times more likely to sign up for auto ship when practitioners offer a discount, which of course may lead to better adherence. And then also the education piece, not just, there are so many people that have come to me from other well-respected holistic practitioners in the area. And I have a large area here because I live in a large city. And when I meet with somebody for the first time, I don't want to know what they're on, what the brand is, what the dosage is, but I want to know what their feeling of is why. Like, why are you on it? What do you think? Because that is where the sweet spot is. That it's like, it's that person understanding us putting the dots really close together and having them connect it so they can own it. I don't even know, I haven't looked at my website in a long time, but I think one of the videos on the website is my biggest health tip is using I statements instead of, well, my doctor told me to do this. Well, they put me on this. It's like, my doctor recommended this and I'm choosing to take it. Like having that ownership, I think increases adherence, but that ownership can only happen with education. So my point is, so many people would come, they'd be on these things. They didn't know why, so they didn't care. They didn't know that this was going to affect their energy level, or this was going to help them recover from the adrenal stress they'd been under for 6 years. They didn't know that. It was just given to them, and they didn't have that piece. And so that's another really big point. And education is where it's at.
The why, I think, like that word is so important. And I always teach my students, if, you can start using functional medicine interventions when you can tell your patient why, right? This is why. You need to be able to explain it. But also anytime that you're making, as a nurse practitioner, if you're making a recommendation or if you're educating as an RN, providing that why, especially in writing, like doing a summary after the visit, this is why we're using this, and this is for how long, and this is what you should expect to see. And, so people have some buy-in for why they would want to purchase that and what it might do for them and what they're looking for. I'm sure you, the same as me, experienced that thing where somebody isn't on auto ship and they follow up and they're like, oh gosh, my joint pain's back, this is back. And you say, well, let's take a look at your supplement list or medication list. And then you say, right. Oh, I see you haven't been taking this. And then they're like, oh yeah, I forgot to refill it. And then they're like, okay, why don't we restart that? And then we'll go from there. Yeah. And you made me think of something else that I wanted to touch on before we're done today is about dosage, and like sometimes we really need to personalize dosages for someone, or they'll tell us, oh, I've taken magnesium before, it didn't work for me. I've taken vitamin D before, it didn't affect, that concern that we're discussing. And in reality, we talk often in this arena about the idea of research shows this many milligrams of this for most patients is effective. But let's say in the case of magnesium, you need to use the right formulation, and then you have to get to the dose that's appropriate for that person and their unique circumstances and their burden, the amount that their body is demanding based on what they're struggling with. And so I feel like that portion that you're talking about educating and having them have like a set up plan for getting refills. And then the part that I always try to talk to my students about is, you can write out this is where we're going to start with this, but we need to follow up and decide, is that the right dose for you? Do we need to go up? When are we going to stop this? We're talking about berberine for metabolic health, berberine for gut health. When do they discontinue that? How long is appropriate?
Yeah. So when those things are time-based, right? So I think that's I think what my experience is, people know, okay, I'm not going to be on all of this forever. If we're doing a gut cleanup, like maybe a 4 or 5 or 6R protocol, right? Know that you're going to go through these phases and these things are going to drop off. That has always engaged people, not knowing that, hey, this is we got some cleaning up to do, and this is a robust recommendation. However, just know that in 2 weeks, this is going to be done. In 4 weeks, this is going to be done. And that really helps people. And I also think, I want to mention this. People also, you said, people might say, oh, I've taken that before, it doesn't work. I think another education nugget for everybody is that, okay, are you going to feel what an optimal dose of vitamin D feels like? Maybe not. Yeah. But are you going to feel what a deficiency feels like when you're overwhelmed with infections or, rickets? Because that is the other piece, right? It's like these optimal labs that we run or the dosages that we recommend are people, it's not like it's speed, right? Or like kava, right, where there's going to be, or like a phytocannabinoid where you're going to actually feel something. But it's that education on why we're doing this. There's so many people that come in with their labs in hand, whether it's a thyroid lab that is, I wouldn't say subclinical, I would say sub-laboratory because they're having clinical symptoms, but the labs are like, oh, you're fine, right? Or vitamin D levels that are one click above rickets. And you're like, hey, we need to optimize that. Well, I've taken vitamin D before, it really didn't do anything. Well, what does that mean? It didn't do anything, or you didn't feel it. And so that education piece is super important about why we're doing these things and what they're going to expect to feel, even if it's nothing.
Yes. And them knowing the why really helps with that. And I'm sure you, same as me, how often do you inherit somebody that's seen a similar practitioner in title, and then they come in with all of these supplements that they don't know what they're for, and they don't know how long they were supposed to be on them. One of my favorite things about Fullscript is being able to do that little drop-down box and say, this is for 2 weeks, and you can write why they're taking it. And so it comes into their when they receive a recommendation from us, it says exactly for how long to take it and how much.
Yep. Mm-hmm. It's super personalized. You can call them by their nickname if you wish. It's that connection that you have the ability to have with people that I think makes such the difference instead of a prescription pad and you're off and running. It's so personal. It's amazing.
Yes. And the last thing I thought of related to what you were saying a minute ago is similar to SSRIs, or a lot of antidepressants. They don't start working right away. And a lot of people have the expectation that whatever we recommend to them is going to start working tomorrow. And that's an education piece too, to say, we're repleting you of something that's deficient, or we're addressing something that's been going on for a long time. And it's going to take us time to see the benefit too. And setting that expectation up too can be, because, you have the people that say, oh, I didn't take it this one day, but then I felt this way, so I took it that day. And it's like, it's not. Let's talk about that.
That is a great point. And, there's a couple ingredients out there that are well studied for vasomotor symptoms. So hot flashes, night sweats, things like that. And they'll say right in their literature that it takes about 12 weeks or more. And that piece is so important for us to know and then us to communicate. So a week later, when somebody's still struggling, they're not like, none with this, that didn't work.
Yeah, Bridget didn't know what she was talking about. I still feel it. Yeah, setting up expectations is so important.
Yeah.
This is such a great conversation. I wanted you to share with us an example of how nurses can use technology to improve patient communication and care in their practice, and how our nurse listeners might benefit from doing it in their own practice.
Oh, sure. I mean, look, when it comes to Fullscript, okay, so first of all, you and I talked about it both. The EHR that I use as well is integrated into Fullscript, and it's just a game changer because just like you're all in one place and you go boop, 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 boop. Saves time, saves energy, saves time as money. It's like, so the EHR integrations are so important. It's just right there. And there's 25 EHRs that are integrated and growing, right? Okay, again, that customizable care plan that's in the app. So dosing instructions, patient education, the guides that Fullscript has, over 160 beautifully designed guides, handouts, infographics, meal plans. If I'm getting somebody started on a modified Mediterranean ketogenic diet, it's just boom, attach, and it's there, well referenced, well cited. It's easy to use right there in the app as well. And then again, like you and I talked about, those automated refill reminders and or auto ship that can increase compliance / adherence. And they're tied right into the patient's treatment plan and also the supplement dosing instructions. And it's a reminder. So before they run out, because life moves fast for a lot of people, especially as we get older, I have realized. And if you don't have a ticker, a reminder, then those things can fall off. And so that's just a couple of ways. But technology, I've always been a late adopter. I don't know. I still like writing things and such. But when you get your practice more automated, you can care for more people. And I think that's really the bottom line. When you're doing good work, when we're having this angle of really trying to not just suppress symptoms, but increase overall health and wellness, then the more that we can do that, I think the better off people in this world are going to be.
I agree. And I can't even quantify how much of my practice is automated now, because that's an opportunity in, when using Fullscripts, and for me using Practice Better, like I'm able, like almost everything is done for me except for actually seeing the person and writing the note, which is what you want to do.
Where you want to be.
Absolutely.
I think I was on a podcast, I don't know, it was a bit ago, but one of the things that it was tips for people getting started. And I would always, and I did this for myself, I would want to hire out or get help with things that I wasn't great at. And I wasn't great at a lot of things. And, we're trained as clinicians and practitioners. We're not trained to run businesses and such. And so why don't you get help with that piece so you can go ahead and do your craft and then just let people like Fullscript do the heavy lifting and take care of the rest. And so it's really helped me so much. And I'm so proud and happy to allow other people to know this. So again, they can do their craft and their work and make this world a better place.
Agreed. And that kind of brings me around to, before we close out, I wanted to acknowledge how grateful we are that Fullscript helped arrange this opportunity to speak with you, because you have a background as a nurse. You have that perspective that is unique to nurses in this healthcare arena that we're in. For me as a nurse, functional medicine was what I had been looking for all along. And I hear so many nurses say that. And like we talked about, that idea of coming home as a nurse. So I wanted to give you the opportunity to share your thoughts on nurses practicing in integrative and functional medicine.
Yeah. So my bottom line, and I will say this, like my nursing education was amazing. You as nurses have such an amazing education. I mean, there are so many aspects of that education, whether it be 2-year, 4-year, it doesn't really matter, or post-grad, that nursing education covers, because you're into the biomedical sciences, right? You basically understand medicine. Again, if there is something missing, that heart space, that you want these more, instead of just, it's as evidenced by in your nursing plan and you're taking a doctor's order, you can actually go there as well. There's the IFM, right? So the Institute for Functional Medicine, where you can get additional training as a nurse, as a practitioner being, as a registered nurse. And there's also, like I mentioned, the American Holistic Nursing Association. And so I always, I am a big fan of, like, if you're pointing the finger out there, there's 3 pointing back at you. So if you're not fulfilled or happy enough with your education or the job that you're in, know that 3 fingers is that empowerment to you, that there are other places that you can go to seek out additional education. And it's not your education, it is the approach. It's how you can approach people. It's that approach that you give. You are asking about their diet needs, their lifestyle, their history, their chemical exposures, all of the things that really do influence our overall health. You get that advanced knowledge, and then you can apply it to people and use a platform like Fullscript to elevate your practice and just soar and fly. So I'm a big advocate of, obviously, being a nurse, finding the Holistic Nursing Association, coming home, advancing my own career as a naturopathic doctor. But in my opinion, we're all in this together, and we all have the same goal of really trying to elevate people's wellness and health.
Thank you. Those are 2 big organizations for me too. I speak every year for the American Holistic Nurses Association because I feel like that is a great support as nurses. That's where we can come together and feel like we're not alone in this journey. And
I miss those. I do miss those. It was like, you want to talk about coming home. That's just that's an amazing, amazing organization. And those gatherings, very, very special. I haven't been in a long, long time, but maybe I will remedy that.
I got so lucky this year because the Institute for Functional Medicine had me come to their annual conference to get it interviewed. And I was going anyway because I love to go and learn. But getting to do that in person again. And then the American Holistic Nurses Association conference was a few days later in the same town. And so it was a very heavy 2 weeks for me, getting to connect with so many like-minded people. And a ton of my students get this nursing foundation in functional medicine through my course, and now they speak the language, like you were naming off those supplements, and I'm like, yep. And I don't ever want the podcast to feel salesy, because my goal is to give this a voice, right? But a lot of people don't know that. Like, my students will take my course and they'll go, oh, I love this, and hormones are my thing, and they go take advantage of that discount and do the advanced practice module through IFM, or they might decide to become fully certified. That might be their passion place too. And every range of it, because I have people leave the course and say, oh, I am ready to incorporate this and let's go. But I love that you brought up those two organizations, because they're both very special to me and a lot of my students too. So I relate to you bringing those up.
You bet. Thank you so much for
Holly. Yeah, thank you so much for being with us today. I know my students and all the nurse listeners are going to really benefit from all of your insights. I encourage them to take a look at the show notes to get links to everything that Fullscript has to offer, and resources to learn more about you as well. So
Right.
Thank you so much.
You bet. Thank you. Take care.
You too. Thank you.
Thank you for tuning in to the Functional Nurse Podcast. If today's episode resonated with you, be sure to subscribe and leave a review. It helps other nurses find this movement. To learn more about our programs and join the community at IFN, visit fxnursing.com. Together, we're not just rethinking healthcare, we are rebuilding it from the inside out.